Welcome to another episode of Talk Sessions, and we'll be looking at what's the relationship between hypertension, kidney disease, and the heart in this session. My name is Dr. Umeizudike. I'm a consultant nephrologist. Looking at the situation that we are in currently in the world, the prevalence of hypertension is on the increase. Similarly, the prevalence of diabetes is also on the increase. And these two conditions have been known to be the leading cause of chronic kidney disease. And with chronic kidney disease also comes heart problems. Hypertension is the number one cause of cardiovascular disease worldwide, which is similar in Nigeria. And cardiovascular diseases also have a way of affecting many of the patients who have chronic kidney disease. In fact, it's been said that when people have chronic kidney disease, many of them, before they get to stage 5, when they need dialysis, actually die of cardiovascular disease, which will include conditions like stroke, heart failure, peripheral vascular disease, heart attack, and the rest of them. Coming back home, hypertension is found to affect 20 to 40% of Nigerians. Many of these people are not even diagnosed. All right? And that's why we call it the silent killer, because oftentimes people don't have symptoms. Occasionally, some people may have headaches or blurring of vision or some kind of chest tightness, but in most people, in over 90% of people, they don't have symptoms. So that's why you're encouraged. Walk into a pharmacy, or if you go for visit someone in the hospital, you're not feeling unwell, but just tell the health workers there, can you kindly help me check my blood pressure? It just may be a lifesaver, because it's not symptomatic. So many people walk around with very elevated blood pressures, which can actually make them a medical emergency when we do those things and we find out that it's that high. Chronic kidney disease, which we said affects 1 out of 10 people worldwide as well as in Nigeria, the leading cause is hypertension. And what do we need to do? Number one is to diagnose, because you don't treat what you don't diagnose. It's just like saying everybody that has high body temperature has malaria or typhoid. It doesn't always follow. There might be other diseases that are leading to this. So you must have a diagnosis of high blood pressure or hypertension to be able to start treatment. So hypertension is defined as sustained elevation of blood pressure above 140/90. Now, sometimes this figure of 140/90 has been disputed, because there are people that present with stroke, heart problem, kidney problem, and their blood pressure is below 140/90. So what are the other things that needs to be looked at? So in essence, when we talk about hypertension, we also talk about associated conditions with hypertension. So there can be elevated cholesterol, there can be elevated blood sugar presenting as diabetes, there can be peripheral vascular disease associated with hypertension, there can be ischemic heart disease associated with hypertension. And so that's why just having a figure of less than 140/90 may not just be sufficient to tell you that you are okay. So you need to look at other things. You need to do a health check to check other organs to be sure that that figure of less than 140/90 is actually not putting you at any other risk, because cardiovascular disease, of which hypertension is the strongest cause and risk factor, can present in various forms. So somebody can have a very high blood pressure of 230/120 and be asymptomatic. Okay, somebody else will have that same figure and he is presenting with a stroke, or is presenting with heart failure, or is presenting with kidney failure. So the figure on its own is good to know the figure, but we also need to know that there are other things that could be associated to make that more life-threatening or less life-threatening. So somebody could have a blood pressure of 140/90 and already has heart failure and kidney failure, but somebody may also have a blood pressure of 140/90 and doesn't have any organ affectation, because high blood pressure tends to affect critical organs like the brain, the eyes, the heart, the kidneys, and the peripheral blood vessels. So what's the connection at the end of the day? In recapping, we need to know that hypertension is often asymptomatic. And so the only way to diagnose it is to have a blood pressure check. And after the blood pressure check is done, we need to establish that that elevation is a sustained thing. Because some people come to the hospital and they're already nervous before you even put this manometer on them to check their blood pressure. So you need to sit down for some few minutes, 10-15 minutes when you want to check it, and do the check. After it's checked once, a second one can be checked 2 minutes afterwards, and the third reading can be done 2 minutes after that. So to be able to be sure that the person is a well-rested condition of his mind before the measurements are done. But when it's established that the blood pressure is elevated, it's not a death sentence. We need to know, or the person needs to be educated to know, that there are lifestyle measures that needs to be put in place, as well as pharmacological treatment that needs to be put in place. And this varies because in as much as there are many drugs to treat high blood pressure, drug treatment is also tailored to what is the overall cardiovascular risk of the person, and also what are the other associated conditions the person may have. Somebody may have hypertension and a particular drug is good for him, but because somebody else who also has hypertension and has diabetes along with the hypertension may not benefit from that same drug. And so drug treatment is individualized, but the non-pharmacological treatment is something that is more or less like a blanket prescription in terms of reducing salt intake, in terms of doing regular exercise, in terms of consumption of fruits and vegetables. And I think I've been able to whet your appetite on more sessions of talk sessions that will be taking on in the next few episodes. And I hope you've enjoyed this session. My name is Dr. Umeizudike, a consultant nephrologist. You've been listening to Talk Sessions. Please join us on our social media handle on Facebook, Instagram, Twitter, and other ones. And as you follow us and subscribe, you'll get to know about all the editions that will be coming up subsequently. This is Talk Sessions. Let's talk about it.